In Part 3 of this module, we are going to review the major articulatory landmarks that you need to know for describing the places of articulation and articulators of the phonemes that we will discuss in the following modules. We will also describe the articulators in terms of whether they are more passive articulators or active articulators. Finally, we will briefly discuss phonation and the difference between voiced and voiceless sounds. On the next slide, you will see a mid-sagittal section of the head. This provides a side view of the vocal tract down the midline, as if a head were cut in half right down the middle of the nose from top to bottom. You can also see a similar figure in your textbook. At the bottom of the slide is a link to a video you should watch, which shows an MRI or magnetic resonance imaging video of the speech articulators in action. The three major cavities of the vocal tract are shown in white and labeled on this slide. They are the nasal cavity, the oral cavity, and the pharynx or the pharyngeal cavity. You will need to be able to identify all of the anatomical landmarks that are shown on this slide. I will use the cursor to point to each one in turn. First, the lips, the nostril, and the upper and lower teeth you should be familiar with. Next, the alveolar ridge is the part of the roof of your mouth just behind your teeth, right here. It might have a bumpy texture. It's usually the part you burn if you eat hot pizza. Next, the hard palate, here, from about here to about here, is the part of the roof of your mouth that is more flat and bony or hard. If you run your tongue along the roof of your mouth towards the back, you will feel that the roof of your mouth becomes softer towards the back. This part is called the soft palate or velum, from about here to about here. The end of the velum is a little piece of skin that hangs down from the roof of your mouth at the back. It's called the uvula, right here. Next, the tongue is divided up into several portions. The tip of the tongue is the very end of the tongue. The blade of the tongue is the region of the tongue just behind the tip of the tongue, right around here. The front of the tongue extends from about the tip of the tongue to where the hard palate changes to the soft palate. So maybe from about here to about here. The back of the tongue extends from around where the velum begins to about where the uvula hangs down. So from about here to about here, or where the tongue becomes more vertical. The root of the tongue is the more vertical portion of the tongue that extends into your throat or pharynx. So the root of the tongue is about here. The root of the tongue makes up the front or anterior wall of the pharynx. The back wall of the pharynx is called the posterior pharyngeal wall. The epiglottis is a small flap, right here, of cartilage that hangs down to cover the larynx during swallowing so that food and liquid are pushed into the esophagus rather into the larynx and trachea. This is very important because if you have liquid or food fall into your trachea, you are unable to breathe and you can choke. Finally, the larynx, about here, is located in the upper part of the neck. Within the larynx are located the vocal folds, which you use to make all of the voiced phonemes. The space between the vocal folds, right here, is called the glottis. Producing speech sounds involves using both active and passive articulators. For each sound, the active articulator is the one that does most of the moving, and the passive articulator is the one that the active articulator makes contact with or moves toward. For example, the tongue blade actively moves toward and touches the alveolar ridge for the t sound, and so the active articulator is the tongue blade for this sound, and the passive articulator is the alveolar ridge. Most, but not all, of the active articulators are attached to the jaw and are moved up and down, at least in part, by raising or lowering the jaw, although they can move independently to some extent as well. The first active articulator we will discuss is the lower lip. It is used as the active articulator in two categories of sounds, the bilabial sounds and the labiodental sounds. First, the bilabial sounds are those in which the upper and lower lips touch, or move towards one another. The passive articulator for bilabial sounds is the upper lip. These are the first sounds in boy, pig, mop, and won't, the b, p, and w sounds. The labiodental sounds are the second category, in which the active articulator is the lower lip. In these sounds, the lower lip touches the upper teeth, so the passive articulator is the upper teeth. These are the first sound in fish and the first sound in violin, the f and the v sounds. The tongue blade is the active articulator for three categories of sounds: the interdental sounds, the alveolar sounds, and many of the postalveolar or palatal sounds. For the interdental sounds, the tongue blade is placed between the upper and lower teeth, so the passive articulators for these sounds are the upper and lower teeth. The interdental sounds are the first sounds in the words think and there, the th and the th sounds. For the alveolar sounds, the tongue blade touches or moves close to the alveolar ridge, so the alveolar ridge is the passive articulator for these sounds. These are the first sounds in the words top, dog, snake, zebra, knot, and lip. The t, d, s, z, n, and l sounds. For many of the palatal or postalveolar sounds, the tongue blade touches or moves close to the hard palate, so the hard palate is the passive articulator for these sounds. These are the first sound in the word show and the middle sound in the word pleasure, and the first sounds in the words yellow, chop, and junk. So these are the sh, zh, y, ch, and j sounds. The tongue body and or the tongue dorsum is the active articulator for the velar sounds and for one palatal sound. For the velar sounds, the tongue body or dorsum touches or moves toward the soft palate or velum, so the velum is the passive articulator for these sounds. These are the first sounds in the words king and gum, and the last sound in the word ring, and the first sound in the word went. So the k, g, and w sounds. The first sound in the word went is doubly articulated, so it involves both a bilabial articulation and a velar articulation. You round the lips and move the tongue towards the velum at the same time. For this reason, it's called a labiovelar sound. For the palatal like in rug, consonant, the tongue body approaches the hard palate, so the hard palate is the passive articulator for the sound. All of the vowel sounds are produced by moving and changing the shape of the tongue body, including the tongue root, in relation to the upper and rear surfaces of the vocal tract, including the hard and soft palate and the posterior pharyngeal wall. So for all of the vowel sounds, the tongue body, tongue dorsum, and tongue root are the active articulators, and the upper and rear surfaces of the vocal tract together make up the passive articulators for the vowel sounds. One part of the tongue typically approaches a particular part of the vocal tract to make the constriction in a more forward or back part of the vocal tract, which we will talk about in the next module. The last active articulator we will discuss is the velum. While the velum can be a passive articulator because the tongue approaches or touches it during the production of some consonants, it can also be an active articulator because it can be raised or lowered by muscles attached to the pharyngeal wall. When the velum is lowered, air can flow out of the nose as well as the mouth, such as is often the case during breathing. When the velum is raised, the nasal cavity is cut off and air cannot flow out through the nasal cavity. The velum is raised for most speech sounds, and so air flows through or resonates through the oral cavity only. The nasal sounds are distinct from other speech sounds because they are produced with the velum down, so that air can resonate in and flow out of the nasal cavity. In this case, the active articulator is the velum, and the passive articulator is the posterior pharyngeal wall. The nasal sounds are the first sounds in mop and not, and the last sound in ring. So n, and sounds.